Infertility is very common in our community. Almost 10 to 15% of the couple meet the diagnosis criteria of infertility. What's the best treatment for the infertility? Hello, this is Dr. Zita Liu. I'm an American board certified obstetrician and gynecologist specialized in infertility treatment. Today, I'm going to review the three major methods in infertility treatment in fertility center. First of all, let's review the process of a natural spontaneous conception. These are female internal pelvic organ. This is uterus. Here is vagina. This is fallopian tube. Here is ovary. On day 2 to day 4, in each menstrual cycle, a batch of follicles show up in the ovary. Only one of the follicles grows bigger, and when it reaches a certain size, the follicle will be ruptured, and the egg will be released from the follicle and enter the fallopian tube. At the same time, sperm come from vagina and enter the uterine cavity, and then further enter the fallopian tube and fertilize the egg. And then the fertilized egg start dividing. After it reaches the morula stage, a cavity will be formed in the center of morula. At this time, the embryo enters the uterine cavity. It is called the blastocyst. The blastocyst then attached to the endometrium, the internal layer of the uterus, and then started invading. If everything's fine, the embryo will continue its development. The clinical pregnancy can be established. There are three major methods in infertility treatment. They are time intercourse, intrauterine insemination (IUI), and assisted reproductive technologies (ART), including IVF, In Vitro Fertilization. Time intercourse is a method to have intercourse around ovulation defined by follicle monitoring or hormone checking. Time intercourse requires female to have a normal anatomy structure and a male to have normal semen analysis. The best indication for time intercourse is unexplained infertility, no ovulation or irregular ovulation of the follicle in a female, or long distance relationship between the couples. Medication is not mandatory in time intercourse cycle. However, if medication is needed, the aim of the medication is to produce more eggs in each cycle, or control the time of the ovulation for intercourse. If the medication is applied, and two kinds of medication will be applied. The first kind of medication is clomiphene, letrozole, or follistatin. They are used to help the male follicle to grow bigger. Another kind of medication are ICG, Ovidrel, or Lupron. They are used to help the lady to define the best time for intercourse. The purpose of this medication to help the follicle to ovulate. During time intercourse, the follicle will be monitored by ultrasound, and we can also monitor the cycle by checking the hormone LH, FSH, estrogen, and progesterone level. And from the change in follicle size and hormone level, we can predict the time of ovulation. And ovulation can also be monitored by ovulation prediction kit. But for some patients, such as low ovarian reserve or polycystic ovarian syndrome, ovulation prediction kit cannot predict the ovulation very well. The best time for time intercourse is 5 days before ovulation until 7 hours after ovulation. A paper from Cochrane Database System Review showed there are insufficient data available to draw conclusions on the effectiveness of the time intercourse for the outcomes of live births, adverse events, and clinical pregnancy. Time intercourse may improve the pregnancy rate compared to intercourse without ovulation. However, the clinical effectiveness of time intercourse is still questionable and controversial. Another method to treat infertility is intrauterine insemination, IUI. In IUI cycle, the semen will be collected and washed and concentrated. Around ovulation, the sample will be injected through a thin catheter into uterine cavity directly. And in this situation, the distance between sperm and the eggs will be closer. The requirements, indications, aims of medication, and medication selection, even timing control, are quite similar to time intercourse cycle. In IUI, and the successful rate of pregnancy per IUI cycle has a strong association with the patient age, especially the lady's age. When a female is younger than 35-year-old, in average, she has 11.5% chance to be pregnant per cycle. When they reach 38 to 40-year-old, each cycle, the successful rate is about 7.3%. And when a lady is older than 42-year-old, the chance for her to achieve the pregnancy in each cycle from IUI is lower than 1.0%. The third method to treat fertility is called ART, Assisted Reproductive Technology. IVF, In Vitro Fertilization, is one of the most common ART. In IVF, the egg will be fertilized by two methods. In conventional fertilization, the sperm and egg will be mixed together for culture. Another method for fertilization called ICSI, by injecting the sperm directly into the egg. After fertilization, the fertilized egg will be cultured in the petri dish in the incubator. In a normal embryonic development, on day 1, we only see one cell in the embryo. On day 2, we see 2 to 4 cells in the embryo. On day 3, there are 6 to 10 cells in the embryo. And we can even culture the embryo to galactocyst stage. The embryo can be frozen at any stage during this process. If we are considering to do the embryo transfer, the embryo can be transferred on day 2, day 3, or day 5 stage. And of course, if we want to know the genetic information before transfer, we're going to collect some sample from the embryo or from the culture medium to check the embryo. Before we get the result, we're going to freeze the embryo. This is a simple process for IVF. How to select the best treatment method is determined by multiple factors, including routine treatment algorithm, medical insurance coverage, and cost-effective ratio. In a routine treatment algorithm, we recommend patients start from time intercourse. If the pregnancy cannot be achieved through time intercourse, IUI is considered. IVF is the last option. However, if the patient already has multiple time intercourse at home, and she also has a history of self-ovulation, at this time, the time intercourse might not increase their chance to achieve the pregnancy, and then we can advance their treatment plan directly to IUI or IVF. If the patient presents to fertility treatment due to gender selection to have a family's balance or to treat their chromosome or single gene disorder, under this situation, we can start IVF directly. The clinical insurance coverage is also very important, and we're going to check which method, such as IVF or IUI, is covered by their coverage benefit. All insurance they document very clearly the number of cycles for each procedure and the benefit or the total sum for each procedure. And the cost-effective ratio are very important too. In time intercourse, the cost is very low, but we know the clinical outcome for time intercourse is very controversial. In IUI, the cost will be higher, but we know it does increase the chance for the patient to have the pregnancy. IVF is the most expensive procedure, but for young patients, and it gives the highest chance to achieve the pregnancy.
The above information represents my personal opinion and is released for medical education to the public. If you have any specific medical question, please review it with your own physician. If you want to be counseled by Dr. Liu, please contact my clinic. If you want to review more education videos from me, please subscribe my YouTube channel, Dr. Infertility. Thank you.